Grace Basalia, like most Ugandans, spends the better part of the day making a living. He works in a car paint distributor shop and he is a car painting instructor.
We don't know. What exactly should I do?
Basalia has been living with mental illness for most of his life. Over time, he has learned what situations trigger his mental episodes and he avoids them. Most of Basalia's siblings are also living with mental health issues.
I know how to control myself and I know how to take my medicine, and I'm comfortable when sometimes you over disturb my head, I switch off, but I'm lucky.
Familial mental illness happens in different generations of a family, but sometimes it affects the family at the same time.
There are conditions that are more familial than others. So that is because of their genetic loading. We provide counseling to these families because they ask the questions anyway.
There is a dark side to mental illness, though. Last month, Basalia's brother, Vincent Cabeza, died under unclear circumstances. He was found injured and unconscious in Butabika Hospital, where he had been a resident for 2 weeks.
I think he was beaten by another group within.
This death highlights the often neglected patient-to-patient violence in Butabika. The hospital was built in 1955 to handle 550 inpatients, but currently it houses over 900 patients with slightly over 200 nurses to monitor them. The hospital does not have CCTV cameras to monitor the activities of the patients.
I have had interaction with many health workers, and I've told them, when we talk about rights of patients in your facilities, it's not only their rights, but also your rights. For example, if you have these patients and you have not put safeguards, what if they harm you? And by the way, this is the reason as to why sometimes patients even escape, because they have faced violence in the hospital.
One of the things we do here is to train our staff, especially the nursing staff and the security staff, on how to handle those kinds of patients.
The human rights of mental health patients, especially those predisposed to violence, remains a contentious issue.
Patients detained in seclusion rooms without ventilation, without sanitation facilities, without being given food, they undress them. So a lot is happening.
While Basalia's family awaits closure over their brother's death, they still praise Butabika Hospital as the only hope they have for leading a normal life.
After realizing that Cabeza died because of negligence they're having a fear that they will not go back to the hospital. I'm convincing them, actually counseling them one-on-one to accept that the other one was a mistake.
For many others, especially those abandoned by their families, Butabika remains the only beacon of hope.
It causes a bit of pressure on the services here. The space, for example, in the wards, we get a bit of crowding. Well, a lot of crowding, overcrowding. The food can become very scarce in the hospital when there are very many of them. The rate of destruction of structures and resources in the hospital becomes very high when you have very high people who are sick.
Mental illness is a disease like any other. The remedy to a normal life, as Basalia's family discovered, is to seek medical attention and follow a strict drug regimen. Everyone is prone to a mental breakdown at some point or other in their lives. But the good thing is that mental health is curable. And in most cases, those affected more or less return to their ordinary lives. Gillian Nantume, NTV.